My name is Ruth Baden, and I'm the Dracopoulos Director of the Berman Institute of Bioethics.
My name is Deborah Matthews. I'm a human geneticist by training, but I do science policy and bioethics research related to emerging biotechnologies, such as genetics, stem cell science, neuroscience, and synthetic biology. I also do teaching in these areas.
Hi, my name is Matt DeCamp, and I'm an assistant professor here at the Berman Institute and in the Division of General Internal Medicine.
My name is Cinda Rushton. I am a nurse. I have a joint professorship here between the School of Nursing and the Berman Institute, and it is a endowed professorship in honor of George and Ann Bunting.
Hi, my name is Ted Bailey. I'm an infectious disease physician and a lawyer. I've been a fellow here in bioethics at the Berman Institute, and I've also been an infectious disease fellow here at Johns Hopkins.
Okay, I'm Sharon Owens. I'm a nurse practitioner and an assistant director of nursing in the Department of Surgery at Johns Hopkins Hospital. I work specifically with cardiac surgery.
Hello, my name is Allison McCaig, and I am a graduate student in the School of Medicine, a PhD candidate in the Human Genetics program.
Bioethics to me is an interdisciplinary field, a field that brings people together from many different backgrounds and from many different disciplines to look collectively at moral challenges in the way in which we take care of people when they're sick, how we try to keep people healthy, how we do science to improve how we can keep people healthy or make them well if they're sick. And also how we should think about what it means to be certain kinds of professionals, like what it means to be a doctor or a nurse or a biomedical scientist or a health policy expert.
So bioethics to me is it's who we are and what we stand for and how we manage complex situations that involve important values. I think bioethics is embedded in everything we do. It's not this separate thing that we do when everything else is done. It's part of all of our decisions, it's part of our character, it reflects our character. It's really embedded in everything we do. And in healthcare, there's a lot of opportunities to ask hard questions.
So bioethics to me is really, identifying any difficulties that the patients or families or staff have with specific clinical situations that are going on, any conflicts in, any moral conflicts or moral distress on the part of the staff or the patients, looking at helping people to help make decisions regarding their goals of care.
I think one reason why it's so hard to explain is, unlike some kinds of ethics, like ethical theory and philosophy, which operates with very broad principles such as do unto others as you would have them do unto you, or do not lie. The kinds of problems that bioethics deals with are very empirically complex. You're dealing with health, which is already an incredibly complex phenomena. So it's not something that lends itself to broad principles, or even if you have broad principles, you always have to think about how you apply them to particular cases, and you have to know a lot about the particular case to know all the things that are ethically relevant about it. And someone who knows a lot about ethical theory may not know a lot about the kinds of facts that are relevant to their ethical theory, and people who know a lot about facts may not know which ones are ethically relevant, which ones are ethically irrelevant. So it's difficult to bridge that divide.
I think bioethics is hard to explain because it covers so much. I mean, you go back to the original word, right, and it's sort of bio, life, and ethics, and so it's by definition a very broad field. I think it's also a broad field because most of us in bioethics think that almost everything we do somehow involves an ethical judgment or a value judgment about what should be done or what's the best thing to do. And so you combine those general fields of life and ethics, and you're going to get something that's very hard to define in these simple terms.
Probably because everybody has different views about what is considered ethical and what's not considered ethical, and everybody is in different fields of science, and bioethics tries to apply itself to every field of science, and scientific fields are so diverse these days that I think it's hard for every type of scientist to try to explain what bioethics is by using one definition.
I don't know what bioethicists broadly think. I don't think I'm an arbiter of what's right or wrong. I think that my job is to identify what some of the issues are, develop frameworks for understanding those issues, talk to different stakeholders about what they believe the issues are and how they feel about the issues. So in my earlier example, how patients or consumers feel about what's being done with all of their genetic information, or what they personally want to learn from their genetic information. I view my job as identifying what the issues are and thinking about ways to maximize benefit and minimize risk.
Well, I can only speak for myself. I think that I co-chair the Johns Hopkins Hospital Ethics Committee. And so I'm often in situations where people ask for help in thinking about hard questions. And the way I approach that is my job is to sort of lay out what the boundaries are of ethically permissible action. So on the one hand, you may have a hard sort of boundary over here that we might say is right, and over on the other side, what's wrong. But it's really not up to me in the situations that I'm involved in to make the final decision. My job is really to try to help people ask good questions, to inquire into the situation so they can understand it, and then give them a sense of what the sort of range of options are. So I rarely say there's only one right answer.
I don't think I would use the word arbiter of right and wrong, because I think that much of what we do in bioethics is helping to clarify and even ask the right questions. So in many of the issues that we talk about, they can be quite controversial, and people can disagree, but we think there's real progress just in having people ask the right questions. And so sometimes when I'm asked this question, I say that the outcome may not be an absolute right versus wrong, but the idea is inherently that we want to be able to do things better, and that alone is a sign of moral progress compared to a black and white judgment of right versus wrong.
That's another great question. I think that some people in bioethics do think of themselves as arbiters. I'd like to frame it a little bit differently. I think one thing for sure that people in bioethics do is clarify what the arguments are on different sides of ethical issues. If one argument for giving ICU beds rests on making sure that we use those beds well in order to increase the likelihood that we'll save more lives, you give an argument or a reason why, well, we should have this as a consideration. But at the same time, in bioethics, we like to give examples on the others. We want to show all the arguments on all the sides of the issue. But I do think the best work in bioethics is not just work that lays out what the issues are, but work that actually takes positions. Now, that's not the same as being an arbiter of what's right and wrong. That's basically saying I've laid out all the arguments for the different sides of the issue. And here's where I think the best arguments fall. That the best argument, the best position is this one. And that's the kind of